You know, every time a doctor makes a decision, there's this invisible framework guiding their hand. It's something much deeper than just medical science. Today, we're pulling back the curtain on that very framework, medical ethics. So let's get right into it.
Okay, just imagine this scenario for a second, and this is drawn from real life. A hospital has one ventilator left, just one. Two patients, both in critical condition, need it to survive. So how does a doctor choose? It's a terrifying question, right? And it's exactly the kind of high-stakes dilemma that medical ethics is built to address.
So how do we get from an impossible choice like that to a reasoned decision? Well, here's our roadmap. We're going to look at the nature of these decisions. Then we'll unpack the 4 core principles that form the heart of medical ethics. We'll also see how ethicists apply them, and then explore what happens when these principles totally clash in the real world.
To start, we really have to get our heads around this. These aren't just clinical problems with a right or wrong medical answer. No, they're profoundly moral questions that touch on our deepest values about life, about fairness, and about individual rights.
So what exactly is medical ethics? Well, simply put, it's the formal study of these moral principles. Think of it as the structured system, kind of like a playbook that healthcare providers use to navigate the complex moral landscape of medicine. It's all about ensuring patient safety and, so crucially, promoting that trust between a doctor and a patient that is really the bedrock of all healing.
And believe me, this isn't a new idea. It's a conversation that's been evolving for centuries. It goes all the way back to the ancient Greek Hippocratic Oath, with its famous promise to do no harm. Then you have the Nuremberg Code in 1947, which was born from the horrors of World War II, to set strict rules for human experiments. And more recently, the U.S. Belmont Report in 1979. Every single step has refined our understanding of how to practice medicine responsibly.
Now, modern medical ethics is often built around 4 foundational principles. Let's think of them as a moral compass, something that points healthcare professionals toward the most ethical course of action, even when the path is anything but clear.
Okay, first up is autonomy. And this is a pretty radical idea when you think about it. It means that every patient is the ultimate authority over their own body. They have the fundamental right to make informed choices about their own medical care, even if their doctor passionately disagrees.
So here's how this plays out in a really gut-wrenching scenario. Let's say a patient refuses a life-saving blood transfusion because of their religious beliefs. The principle of autonomy says that their choice must be respected. It's a powerful and honestly an incredibly challenging principle in practice.
Next up, we've got beneficence. This is kind of the proactive side of the coin. It's not just about avoiding harm, it's about taking positive, decisive steps to help the patient. It's the duty to actively promote their well-being and to always act in their best interest. A really simple example of this is a doctor recommending a treatment plan that they believe offers the absolute best chance for recovery. They're using their expertise to actively do good for that patient. That right there is beneficence in action. The third principle is probably the most famous one, non-maleficence. This is the core commitment to, first and foremost, do no harm. It means that any medical intervention has to be weighed against the potential for causing unnecessary pain or suffering. So, for instance, a surgeon might decide against performing a very high-risk surgery on an elderly patient. And you might ask, why? Well, it's because the potential for harm, things like a painful recovery or a lower quality of life, might actually outweigh any potential benefit. That's a decision guided by non-maleficence. And finally, we have justice. This principle zooms out from the individual patient to the entire system. It's all about fairness, making sure that healthcare resources are distributed equitably and that all patients are treated with equal concern, no matter who they are.
The standardized rules for organ transplant lists are a perfect example of justice in action. The whole goal is to use objective medical criteria, not someone's wealth or status, to decide who gets a life-saving organ. It's about giving everyone a fair shot.
Okay, so we have these 4 principles, but how do we actually apply them when the pressure is on? Ethicists often look at problems through a couple of different lenses, but the 2 biggest ones are a focus on the rules versus a focus on the results. On one side, you've got deontology, which is all about the rules. It says certain actions are just inherently right or wrong because of moral duties. So a deontologist might argue you can never break patient confidentiality, period. But on the other side is utilitarianism, which is all about the outcome. It asks, which action is going to produce the greatest good for the greatest number of people? This kind of thinking could lead you to say, prioritize vaccines for high-risk groups to save the most lives overall. Now, this is where it gets really, really complicated. In the real world, these neat principles and theories don't always line up perfectly. In fact, the toughest ethical problems happen when they directly conflict with one another. Let's look at a couple of examples.
So let's go back to that earlier example. A patient with leukemia is refusing a blood transfusion that would almost certainly save their life. And this isn't some hypothetical. It's a real and challenging scenario that hospitals face all the time. The conflict here is immediate and it is intense. The principle of autonomy, the patient's absolute right to choose, is on a head-on collision course with the principle of beneficence, the doctor's deep duty to do good and save that patient's life. So, which one wins? Here's another classic dilemma. A psychiatrist is in a session, and their patient reveals a credible, very detailed plan to seriously harm another person. What on earth does the psychiatrist do with that terrifying information?
Again, we have a massive conflict. The doctor has a deep ethical and legal duty to protect their patient's confidentiality. But there's also something called a duty to warn, an obligation to protect the public from foreseeable harm. So the needs of the individual patient are pitted directly against the safety of the entire community.
So what's the solution to all of this? The most important thing to understand about medical ethics is that it's not an answer key. It's a map. It gives you a framework and a structured process for thinking through these impossible choices, but it very rarely points to a single, easy, right answer. And what's really critical is that doctors don't have to navigate this maze alone. Hospitals have ethics committees. These are groups of doctors, nurses, lawyers, social workers, even community members, and their job is to review these complex cases. They provide guidance and help find the most humane path forward in that moment. Ultimately, medical ethics isn't about finding perfect answers. It's about having a process, a commitment to reasoned, compassionate conversation in the face of so much uncertainty. It provides a crucial framework for healthcare's toughest decisions. And that leaves us with a final thought. We all face moral choices, big and small. So how do you navigate your own moral maze?